everybody's got their books and such, yeah?
Yep.
Can I reintroduce myself? I'm John Boswell. Hi.
Leslie.
Leslie.
Cindy.
Cindy, great. Wonderful. So, I'm an ER doc by training. My role for JUMP is to help organize, create funding, and create programs here. So I'm really excited to actually do this. And I have a background in patient safety. I've been doing that for a while too. So this right here is a great opportunity because it actually is one of the keystone components of the course and our approach to really respect professionals in their current status. And what we meant by that is we really took a look at this opportunity and said to ourselves, well, the existing training devices that are out on the market that are technical training devices are actually quite rudimentary. They are typically GU presentation with a great big urethra that you just couldn't possibly miss, like wow, and that's just not real life, right? And what may contribute to infections may be the more complex presentation. Perhaps the older patient, the nursing home patient, maybe some skin breakdown, maybe some not so awesome down there. You get the idea. So we actually asked our engineers to design for that and to create a more challenging, more representative anatomy of what may be more realistic. Certainly not everybody's anatomy, but a more realistic and challenging and respectful to the professional who for sure has done this before, right? So we created some tools for you. Let's come in a little closer. And in your book under the tab that is for us now, which is this insertions tab, you'll see all our materials. I'm going to run real quick through all the stuff that you already have here available, just to give you an orientation to them, and then we'll practice with each other, okay? That be all right? Okay, good.
Not on each other.
Yes. We're going to practice.
Get ready, Inga. I haven't done this in years. You'll be fine.
I'll sign up first. Take a look at this. So first, actually, I'm going to start backwards. At the end of the tab, what we have, oh, they didn't reorder this. Okay. What we have, oh, interesting. Okay, here, this is the insertion checklist by competency. I'm highly confident that you are highly familiar with the standard checklists that are provided for the insertion of a urinary catheter. And they start with actually making sure there's a physician order, etc., and running through in a sequence from start to finish. Here, we did something different. We wanted to point out that there are many domains in a standard checklist that aren't just the technical components. And so, things such as showing compassion, like patient privacy, team support, gathering enough people to actually do the job, some critical thinking, right? These are all items you can see that's broken down by equipment present and safety, and then the technique. If you actually look at the learner's ability to put in a catheter, sort of as point of illustration, certainly there are a number of technique components, but geez, there's just so much more to a professional putting in a catheter done well that are in totally different domains. So in part, to illustrate for you all that these are great opportunities to do the needs assessment around far more than the technical proficiency of sticking the catheter into the urethra. And so I've broken those down to highlight that. We also have available for you the same checklist in sequence from start to finish, and you'll be leaving here today with a copy of that as well. I had thought it was actually in the last page of the handout. We'll make sure that it's in there somewhere. It probably just isn't where I thought it was. So does that make sense? Now, since we're here to actually address your ability to have this focused moment around this procedure, we are definitely going to practice with each other. But I wanted to highlight the worksheets that are here as well. If you look at these, you'll see that we've used the same format of information, instrumentation, right, and incentives. And we've given these little prompts, right, in each of these domains, so data, knowledge, skills, etc., and given blank space for areas that you notice are maybe, needing improvement. And Items also, which is just as important, is where they're just doing a great job, right? And so those can be reinforced. So to reinforce the resiliencies that people have and to address the vulnerabilities that people have in their work environment. And to really look across, again, across the domains. So I'll give you an example in just a moment from the last class we taught with this and how that worked out. But before I do that, if you get stuck, right, and you just are not sure how to really continue the conversation, we then filled out prompts along those domains as well. So like you're watching the technical, right, and you're thinking, gosh, I really should ask more questions about the safety environment or the preparation or motivations on the floor. There are prompts here, and we strongly recommend that you take a look at these because you'll commit them to memory, and then when it comes time to actually do the little focused event, you can just go right to them and say, oh yeah, this is a good question, or how was that question phrased, or how was that statement phrased, right? So, example, I'm just picking one at random. What has worked best for you for determining the optimal frequency with which to post the information, right? So you're trying to address an open-ended question about how do you really gather information about your current rate? Like, how do you know about that, right? And that exploration can happen in this moment. So let me take it all the way back to the beginning. The provision of this device is to, first of all, address the fact that the insertion is actually far more complex in real life than little goofy simulators can produce. Number one, this is a presentation that's far more difficult. The tissue is more flexible. You actually have to move things to get to the urethra. This is a little bit more lifelike and challenging. But this is just an object, right, which allows you to engage that learner as they're putting it in and as they're doing their thing, to ask questions about their environment. So I heard the little story about the doctor who really just refused to. So this would be an opportunity as they're putting the catheter. So what do you think those limitations are? Do you have any physician-related limitations? Tell me about those. And so while they're working in this context, they're thinking about, oh, I remember a patient who, or right, and then draw on those anecdotes. Okay? So it really de-emphasizes the technique. It's an opportunity to see if technique is okay, but it de-emphasizes technique, and it really goes to that more robust circle of all the things that it could be: motivation, knowledge, et cetera, et cetera. Does that make sense? Okay. Please. So here's the deal. So I asked the engineers to give us redundant tissue. It's a bit more redundant. They went after something that's a little edematous in appearance. Okay. I wanted some very flexible materials to be used, so that there was the need to move the labia apart and actually maintain, because it's my construct, because I got called to put these in all the time on second round, it usually was more of a challenge, and the things that did technically get in the way is when you lost your grip, or perhaps there was a pannus and you needed help, right? And it isn't the simple, like, let's just put a catheter in from across the,
right.
It's actually far more challenging than that, and so we gave this. These will fall apart. They're not designed to be infinitely durable. They cost us $12 to make, something
Really?
around that.
Wow.
I don't know if we told Adam that, but it cost somewhere in that order for us to make a production level, like we did 175 of them, I think, or something like that. I forget what it was, something like that. What we want you to do is take this with you, because you get these, right? And
Awesome. Thank you. I've never been so excited about.
So we don't have
Thank
these
you.
paper mache ones?
Yeah, we have paper mache.
And we're gonna post online do-it-yourself instructions,
Okay.
and we're also we'll extend to you an offer to actually make sure you have these for a period of time. Make sure that you can use them. So we'll ship you a
Great.
replacement if we need to.
Thank you.
It's actually easy to repair, and
Gorilla Glue.
we went really low. It's actually silicone, and you can get that like Walgreens. So but there's instructions for use. There's a whole kit that comes with
This is
this.
great.
Okay.
Thank you.
So let's practice though, okay? So this is an opportunity for us to use, again, we know that we have good people here who have good technical skills, okay? There's some assumption that that's there. These are also opportunities to look for those systems issues and other other issues. Now I'll tell you my little story from last time, but you can't use it, okay? So we were doing this last time, and one of the nurses said, okay, well, I'm gonna put an extra pair of gloves in my pocket. Now, in our kits, and like theirs, there's a pair of gloves. But it was her experience that, especially with a challenging anatomy, that sometimes you lose, and if you didn't put the gloves in your pocket before you went into the room, you were perhaps tempted to just go for it.
Ah.
And so she always put an extra pair of gloves in her pocket whenever she was doing this. So look at this from a systems. Where are the extra gloves? How are they stocked? Where would the nurse get those?
Sure.
Right? And so it was a nice conversation point. And those are the things we're going to practice together, and that would be a success story, right? So we've addressed when we, violate our sterile glove. It's the wrong hand, but when you violate your sterile glove, how to be resilient to that. Well, I'll just have another pair. Genius. Okay. Who would like to be our first insertion person? You were so excited to get your very own.
Sure. I haven't put a Foley in like 15 years, so I'm just gonna.
I don't want to put anybody on the spot, so if you're
No, it's
truly
okay.
uncomfortable.
No, it's fine, because I
Okay.
mean.
You're among friends.
Okay, then I would suggest we can use this side right here.
Okay.
And I'd like one volunteer to actually be the facilitator to start, and then kind of midway through we'll switch and let another person have part of it. And again, we want to talk, there may or may not be technical issues to discuss,
Okay.
but again, we want to focus on those other issues in the full scope, right? So where do you get data, right? How do you become informed about, and how's your teamwork in the environment? So if you wanted to take, as we get this set up, if you want to take just a minute to look at your prompts, which are the ones that are filled out in your booklet, which are these. Right?
Okay.
These are some of those questions that you may use to prompt among those different domains. So
Okay.
just take maybe one sample from each and just put it in your mind.
Which category?
Okay?
Can I refer to my text as we're going?
Oh, absolutely,
Okay.
ma'am. This is not a, high stakes exam. And then, of course, we're giving you all these. You're welcome to write in your books.
Okay.
And there will be plenty of copies for these, and you can download them and print them and whatnot.
Okay.
So, okay? So,
Are there like regular gloves in here and sterile gloves, or just not?
I know that every kit's different,
Yeah.
so this was going to
Yeah.
orient you. This particular one does come with gloves, and it comes with pretty much everything you need.
Okay.
We also have a little stack over there. This
Okay.
is not a test,
Okay.
okay? This is just practice, so
Okay.
you could go ahead and just start getting
All right.
yourself set up here if you'd like.
So I'm gonna wash my hands.
Ah, that's standard. And I don't know how you want this angled, but
That's fine.
and I'll get out of your way. How's that?
So I'm gonna come to this nice lady and tell her that for whatever reason we're gonna have to put a Foley catheter in today, and then I'm gonna explain to her like why.
And who's doing our first facilitation?
I am.
You're going to lead our facilitation, and about halfway through I'll go like that, and you could take over with a couple questions. Is that okay?
Okay.
Unless you feel very strongly
No,
compelled to
okay.
just jump in.
I'm gonna shut the door.
We're going to have.
Yeah, you throw a curtain.
So, I'm not, all right. Leslie,
Yes, ma'am.
how do I begin this?
Okay. Well, thank you for asking. So I would say, hey, Leslie, today, this is a great opportunity. We want to have a conversation about placement of the urinary catheter. And yeah, this helps us with technical competency, but we want to have more of a robust conversation, right? So maybe introduce that you're not just going to focus on the skill. Certainly we can see the skill, but you want to have a broader conversation.
All right, so Leslie, before we begin, can you just explain to me how you've been competency or validated on your Foley insertion skills in the past, and how this process has been validated or demonstrated? I'm a little, I'm new in this role, so I need to just get that background.
Okay, so when I was in orientation, I went through orientation and we had a skills lab, and we learned about Foley insertion and we demonstrated. And then when I was on the unit with my preceptor, she would observe my Foley insertions and check me off. And then yearly, we have a computer-based training program, and then we take a test afterwards in our competency. And basically, that's it.
Okay, and so what is your, can you tell me a little bit about your catheter-associated infection rates on your unit, and how do you get that data?
From the infection control nurse, who sends it to my manager.
And so what is your...
I'm not sure what my rate is.
Okay, all right.
I don't know.
So this is great.
That's very
Very nice. I would, and in both cases you asked more an open-ended type of question, which is really good. Now, what's the gap that was seen in this particular case? So she has information, but
Would you be interested in getting more of that, more information on your data?
Yes.
Okay, so we'll see about getting that information to you, and how would you like that distributed? I mean, how would you like to see that information come to you?
Most of our data is displayed in the nursing lounge on like a board, and it has all our data. So we know to look there for our data.
Okay, and what unit do you think is the best performing unit as far as catheter insertion?
West 4,
And why is that?
because they're a surgical unit.
So what makes a surgical unit better than your
Because
unit?
they understand sterile technique.
Okay.
yes. So it's a nice point in time, because you want to let them flow through the procedure too, to introduce them to the model and tell them that the model is a bit more challenging than maybe the model you were used to competency, and that's so that we can have a better conversation.
Okay, so this model was this great device that we got from Jump Simulation. It's a little bit more challenging from something that you may have been familiar with in the past. It's more representative of genitalia that you may see on a real person as opposed to the paper mache models that we have on the unit. So this will be something that you would see on a real female patient. So just expect that it'll be something representative of an actual person.
Okay.
So as you go through this, I would like you to demonstrate the actual technique that you'll be presenting for a real person.
Nice transition.
Take your time, if you have any questions along the way, and just relax and pretend I'm not here on this.
Yes, I'm very nervous, to tell you the truth. I'm not lying.
Likewise.
So I put the shiny side down. Can I move this back?
Yeah, this is one of the advantages of the model.
Okay, and then I already washed my hands. Do you guys do, because ours have pericare in them.
Yeah, ours does too.
You'll see there's lots in here. And in each case, your own kit will be perhaps more familiar with the staff, and obviously this one isn't. You can go
Okay,
ahead.
so I'm gonna do pericare. I have non-sterile gloves on, and I'm gonna do pericare with my wipes. I'm gonna take my gloves off, and I'm gonna wash my hands with the little thing inside, and now I'm gonna put my sterile gloves on.
Yeah,
Ours does snap
Snap
gel.
Oh, you know what? I'm contaminating this whole thing. Ugh, I think I touched that.
So in terms of facilitation, right, you have a decision to make. You could say, okay, well, let's
Start again.
restart.
So what would you
Yeah,
do if this was a real patient?
And
Then
and
I
you
that
realized-
right there,
fully kit?
that is exactly what I was going to advise.
If it was a real patient, I would go get a whole new Foley kit and start over.
Okay, great job. Well,
Thanks, Ingrid.
so we assume you got a new new kit, and we
Okay,
right
I'm gonna
back to
hold
where
my
you
gloves,
were.
so I put new gloves on.
Okay.
Okay, so I'm gonna take,
So Leslie, if you were observing a peer doing that, and that had just transpired, how would you react to that?
Love that question.
I would point out, or ask them if they knew that they put a hole in their glove, and then suggest if they didn't want to, I would use ARC. And I would tell them to go, I would raise a concern.
And how would you feel if they were a physician?
I would feel more nervous, but I would have to, and under patient safety, I would have to point that out.
Okay, excellent,
Very
thank
good.
you.
So now I'm gonna put this little thingy over my patient. Whoop. And then, these are different than ours.
So I wanted to point out that in the instructions for use there, it recommends a lot of lubricant. This is a decision you're gonna have to make. So the betadine will actually discolor the silicone, which
Oh,
it's your model. So if you don't care, you know, there's no reason why the skin tone couldn't be darker.
sure.
Do you know what I mean? It's still needed a decision to make whether or not you felt it was an obstruction to a prompt to use betadine.
Okay.
You know what I mean? Like it would be a trigger.
Mm-hmm.
Oh, it's brown. I forgot to put the betadine in. That's
Okay.
pretty unlikely, frankly. So just so you know, it will discolor it.
Okay.
That's my garbage can.
All right.
So
Alright,
pick another domain. I think you're doing a
Alright.
great job. So you've hit data and you've hit a couple technical things. I always love to draw out anecdotes. So tell me about a case that you had recently that was difficult to put in a urinary catheter, like for example.
Alright. Oh, I had this lady and she was squirming all over the place, and so I had to ask another nurse to come in and help me put the help calm the patient down and.
So that's a great example, and you know, I observed that a lot of our patients are larger, and how do you recruit other nurses to assist when the unit is busy and you need assistance with helping hold or reposition a patient in lithotomy?
I would maybe call the patient care tech
Okay.
and have her help me do it.
And if they're not available?
Call the charge nurse. Help. So,
Very
I feel
fine.
like I didn't set this up right, but. So, and I'm not gonna put I don't lift the plunger out and put the, this was all sterile still. Put the, this in the plunger because it clogs up the hole. That's what we've been told.
Okay.
So now I'm gonna take my,
So for your model, do you, just a point of clarification, do you want us to use the betadine on
It's
your
your
model?
model. You get to
Okay.
take these home, so. You can just, if you don't want to discolor your model right now,
oh
it's
yeah,
your
so we
model.
can, okay.
you choose, like, you want it brown, you don't want it
So actually, if I was really doing this, I would have this in between the patient's legs.
brown. Yeah, you can move it
Because-
there if you want.
Okay, so I'm not contaminating Inga.
Okay, roger that, Lizzie.
Okay.
So Lizzie, when we flow to other units, have you noticed a consistency in technique when you're assisting other nurses in catheter insertion?
Yes.
And so pretty much all nurses are inserting catheters in the same fashion using serial technique?
No. Some units like don't use the drape here. They just throw that away.
So there's a variation in
There's a
practice.
variation in practice, and also we have all kinds of different Foley kits.
And so why do you think that is
The variation
in practice? Yeah.
Probably who trained them, who they learned from. If someone had bad habits, maybe they went along with it and just kind of went that way.
Okay.
Time, not understanding.
It's funny you mentioned the throwing the parts away. That's exactly what we witnessed last time.
Yeah.
We're like, oh, I just throw these things away.
Yeah.
Oh. Anyhow, opportunity to have that discussion.
So then I'm gonna tell my patient, like, you're gonna feel my fingers
Good.
touching you, and this is problem. I'm gonna clean you off here, so it's gonna be pretty cold. Wow, this is harder than.
Mhm.
Okay, so I don't want to touch any. So I'm gonna wipe on the outside labia, and then I'm gonna wipe on the inside labia, and then I'm gonna go down the middle. And then I'm gonna take my catheter. Wait. And I'm going to feel some pressure. Take a deep breath. I'm going to insert it until I see urine. Am I in the right hole?
The first use, the one-way valve is a little stiff, so you just
Okay.
give it a little pressure and it'll go.
Let me
How's
see.
it? How's it going?
It's going.
Yeah,
I see it in there.
Yay.
So after I see urine, I'm going to go like 2 more inches. And then I'm going to fill my
Everybody gets nervous that that'll explode,
There you
but it
go.
doesn't.
All the way. I'll get that later. And then I'm gonna pull back to
Careful,
I feel.
it's backflowing.
Oh, jeez. Okay. Well, I just contaminated everything. Sorry. So then I'm gonna pull back until I feel pressure, and then I'm gonna put the stat lock on, and then put the Foley on her leg, and then I'm gonna put this below the level of the bladder.
So you can see here that there's a little urine flashback that comes out when the
Yeah.
catheter is successfully placed. And
Very cool.
now all we did is that's water with a bit of yellow food
Yeah.
coloring. It's not a big deal. If you want to refill it, this is a nice way to do it. You know, you just refill a little tube. A little cap comes off. You may notice on the top that there's little holes here to allow air to come inside. That allows for it to flow.
Oh, that is so
Yeah.
cool.
So while it's filled, you don't want to flip it over because it'll leak a bit.
Sure.
It doesn't make a big mess. And then when you store it, you want to definitely dry it, like, you know, empty it. You don't want to, because your fake urine will get funky.
Oh.
Would you like to practice a facilitating question or two?
Sure.
I'm gonna start over because I did it terrible.
No,
No,
this
but-
is still that great opportunity because you've just had the experience, and maybe these memories of recent events, et cetera, are more fresh to you.
So what would you have changed then? You feel like?
I feel like I would have set myself up more at the beginning and put this like between her legs and moved this
Okay.
back a little bit, and then, and like got to know the kid a little bit better before I got started.
Okay.
So
Have you ever been helping someone where you've noticed they've, made an error or they've contaminated
yes,
in the middle, and then what did you usually do?
if I would tell them what happened, and if like we needed to get another Foley kid, I could run out and get a new kid or whatever. So like if he contaminated, stop and. Or one time I was really nervous because it was an older nurse who was mean and I didn't tell her because I was too nervous to tell her. So.
Okay. So what will you do with the bag now that you're?
Oh, the bag goes below the bladder, usually kind of by the foot of the bed, and then put the stat lock up against on the patient's thigh, and then use the sheet clip to clip this on the sheet so that the tubing doesn't get all looped up and kinked up.
So why is the stat lock so important to?
So that when the patient moves and stuff, this isn't like pulling and tugging on their lady parts.
And why are you gonna clip it on the sheet to prevent the loops?
Because the sheet clips helps the tubing go a little bit straighter, and then it doesn't like loop up all around. Because if the urine collects in here, it'd get all funky, and then if it goes back in the patient, it would be bad.
So how did you think you did?
Not good.
Why
I
not?
don't know. I was nervous, and I think I contaminated a lot. So
You really want to hang that somewhere, don't you?
yes.
See the distress. You may notice that we wanted to make this tabletop ready. Obviously, you could do this at a bedside, you could do this in a conference room, but you should be able to get through. We did think that having the technical present was a good format for asking all the non-technical questions. And it does give you enough.
She was incontinent.
Is it leaking?
Oh yeah, it's leaking.
She was incontinent.
Something's leaking.
Oh,
That's all right.
oh,
I'll take this one home. I love it.
we'll get you a different one. I've not seen them leak before.
It's probably my technique.
I
Shoving it through. It's gonna go in.
So, so what are your thoughts about this experience? You think you can carry this out?
Yes.
Yeah. What do you think about the model, per se?
I thought the model was good because it was
Good,
kind of like
yeah.
difficult to find the urethra.
Right.
Like you're right, more realistic.
Yeah.
Yeah.
For sure.
Definitely more realistic.
Do you care to? Would you mind to hand that one over?
Sure.
Because I don't know if you had a chance to take a peek
No.
or to feel it. It's a bit more flexible. The models that we found commercially had a firmness that was very much plastic
Yeah.
rather than flesh-like, and literally the urethral opening was just like you could hit it from across the room.
Yeah.
Yeah. Yeah. Most of them were.
You may notice that it does not have a vagina. This was a vigorous
Right.
debate. And certainly there is a known thing that happens where if it's not placed like if it accidentally is placed in the vagina, that there's a temptation to kind of go,
Mm-hmm.
oh,
Yeah.
you know,
Right.
put it in the
Yes.
correct place, which is the wrong
Yes,
thing to do.
yes.
So in version 2, we may actually add the vagina back in,
Uh-huh.
but we were kind of pressed to get this thing out and in use. So it doesn't have one right now. If you feel strongly about it, we can address that,
Drill a hole.
something like that. So, but
No, I thought this was good.
Uh-huh.
all right. And what do you feel about the facilitating tools? Useful?
Yes.
It's our recommendation again that you just take a little bit of time to read through the questions because it'll
Right.
prepare you, and then take the stimulus guide in with you, and you'll get stuck. You know, something will and you'll have these little things to refresh you and to ask the questions.
Yeah, I thought she was doing a better job than I was doing.
I think everything gets better with practice. So it is. The temptation will always be to go back to the technical.
Uh-huh, right, that's
Right?
right.
And such an opportunity to hear all those stories that you want to hear. Oh, the doctor doesn't allow for, or my staff, doesn't understand why this is important, or I've noticed this and that, or, we never have the right, simple things, hard things, so.
I almost felt like I was distracting her because she was concentrating.
Yeah, that's true.
Absolutely.
By asking all those other questions.
Yeah,
So as you become perhaps familiar with this, you'll get a sense of timing.
yeah.
Now, this will likely take a bit longer than a simple procedure in a controlled, patient circumstance. But then you'll just know, you'll get a theme for how long it takes you to get through while asking questions, and it becomes more conversational,
Yeah.
right? Less, I'm filling out a checklist on your competency, more, I'm having a good conversation with you around all these patient safety issues that you encounter on a regular basis.
Because even right now you have that soothing conversational tone, and I felt like I was more interrogational.
Oh, I didn't think
Again,
of it
everything,
that way.
each has their own style, and but
Yeah.
with a little practice, I think what we discover in our In Situ program, right, is that conversational tone brings out those anecdotes, and actually we'll discard our debriefing notes to get to the anecdotes, because the anecdotes become these rich environments. Okay, let's stop talking about our sim we just did. Let's talk about that anecdote more.
Right.
Because it's fresh, it's personal, right, and it's an opportunity to understand the needs. So, if that's the thing that happens, that's like a pot of gold. You know what I mean? Oh, I had a patient just like this, and they had skin breakdown just like this, and da-da-da-da. Oh, tell me all about that. Tell me all the constraints. Tell me how, was the staff helpful, like,
Yeah.
so, anyhow. How does it feel?
Good.
Feel okay?
Yeah.
All right, I'm gonna stick behind to empty the urine, okay, and to put these into the box. And I'm gonna get you one that doesn't leak, or figure out why it leaked. And I believe you're gonna move to the next station.
There you go.
Hello.
Hi.
Good job, team.
You didn't leave the whole mess, and you're gonna walk away from it.
I haven't heard that.
No,
Like,
it's
so- Okay.
I know that's against your nature, right?
Yeah, you're right.
All right, well, come out here.
Thank you.
Absolutely. These will be sitting in the center for you to take. They're gonna be in these little white boxes here.
Oh, I'm so excited. Thank you.
I know.